Hey,
Hi Raji, how are you?
good. How are you?
Good. Let me message in the group as well that we have opened the Zoom. Started. Let me let me allow you share screen, okay?
Yeah.
Okay, now you should be able to.
So should we give a couple of minutes? Start.
Yeah, let's give a couple of minutes to start.
Okay.
I guess we can start, Rajeshri.
Okay. Okay. So who wants to go on this one? Hello.
Okay, I mean, I was just I can do this one.
Okay.
You have one question on it. I mean, I was 1 point. Okay, I'll tell it when we come to that. So for me, the population of concern in this one was the aqua population,
Okay.
colored population. In the next kappa to lambda graph, I think these are the normal kappa to lambda ratio cells, and then in the next, and the aqua is hiding behind the red one to me.
Correct.
Over
Yes.
here.
Yes.
So, then in the next plot, this aqua population is 19 positive, 5 negative.
Mhm.
And in the next plot, this aqua population is, it's like kind of moderate 19, and then it's 38 dim to moderate positive. Again, 19 positive, 10 negative, 200 negative. So that's important to me. And then it's 20 positive, moderate to bright, 19 positive as we have done before, 5 negative we did before, 38 we did before, 10 negative. Then when we are doing its kappa to lambda, I think I was between kappa skewed versus kappa restricted because I'm more used to those lines that help me here. But I think it is kappa restricted, but I just wanted to make sure it's not, skewed, because they were kind of very close. But I mean, if I was to interpret, I would be at restricted.
Okay. So I agree, it is restricted, and the reason that you're not clearly seeing it is because the FTSE here, the kappa was with FTSE. Usually it is with FTSE. It was not very bright in our lab there. And actually, you see the red population of normal B cells with kappa, and it is matching in the intensity. In fact, it is even a little bit brighter than the normal background kappa B cells. So that's
Okay.
what helps. And also, when you describe 19, you said it's moderate. I think it is decent, bright. actually,
Okay.
because you see your background polyclonal B cells here. This one has a little bit brighter 19 than that, and actually that is nicely demonstrated in the 19 versus 10 plot here.
Okay, good. Thank you.
It's here, but this one, it's at least a subset looks brighter.
Sure, sure. Thank you.
Yeah.
Yeah, it's helpful. Thank you.
Right.
Yeah.
Yeah,
So,
200 is negative. It doesn't carry any significance as such. You can say it does not have a phenotype of CLL in this one.
okay, so negative 200, we were like, it is negative in mantle cell, right? That's
Right. It is negative in mantle, but you don't call mantle by flow anyway, right? I'm saying
Yeah,
in
we
that
don't.
angle.
Yeah. Mhm.
So
So I would
tell me.
probably leave it as CD5 negative, CD10 negative, kappa restricted B cell neoplasm, and then correlate with morphology and
Exactly. That's
thereon.
exactly what we need to do for this case. This was a 5 negative, 10 negative B cell neoplasm. But considering, but this is a lymph node. So, I mean, by morphology, we did not have much suspicion for hairy cell. But considering how bright the 19 is, 20 is, and how it is negative for 5 and 10, do you think this can be hairy cell? Would you consider hairy cell in this one?
Like with bright 19 and 20, I think of those entities, but then there are other tubes like 11C23, 103, those ones that we do. But like whenever I see 19 and 20 bright, like that's first of my differential that I think of. Yeah.
Okay, but hairy cell is usually positive for 200. That is one other place where 200 can be helpful, but it's not specific.
Okay.
It is usually positive, but again, you have to not rely on that, but correlate with your morphology and 103. But it, hint, it gives you a hint. This was actually a marginal zone. Okay. Anybody has any questions?
Maybe for the audience, you can enumerate the other populations, Haji.
Okay, so I'll go over it again. It's pretty much the same like what we described the previous time. The yellow population has high site scatter and it has brighter 10. Those are the granulocytes. And this population with bright 5, that is T cells. And one thing that I want you all to see when you look at your T cells are that they will have a little bit of dim 20. And T cells have that a little bit. So that's okay. I mean, you'll see like a spray going towards 20, and even there are some T cell neoplasms that express very dim 20. That is okay. It doesn't make it like ambiguous or something. T cells do have that little bit. And this bright 38 population with 19, that is our plasma cells. And yeah, that's pretty much what we can say for sure here. And the green population is lambda, normal background lambda. Anything else? And your plasma cells are negative for CD20 here, like normal.
Pretty good. I guess we
Okay.
can go ahead.
Okay, we'll go to the next one then. I'll do 7 and then 7.1. Okay. Who wants to do this one?
I can do if nobody else is doing. I mean, I'm just waiting for others to have turn too.
No problem. Carry on.
Okay, so this one was kind of classic case to me for hairy cell. So on this one, we are targeting on the blue population, which for 20, it is kind of moderate. I'm used to see a little more bright for hairy cell, but it is like 20 positive, 34 negative. Then again, 20 is moderate, going a little bit brighter there, and is Give me a second. It's lambda
Okay.
restricted, and then 71 negative, 34 negative. Where is it now? Okay, then it is positive for this 19 positive population is positive for 103, which is important. And then it is again moderate 19, and it's 19 moderate, and then FMC 7 positive, 200 negative, 23 negative. It's again kappa negative and is lambda positive population. And then when we are going into hairy cell tubes, it is positive for 103 and 22 positive and 11C positive. And those are kind of towards the brighter end, which is good. Like that's what we want for 11C, bright. In this hairy cell, it is usually bright. So I would call it hairy cell leukemia upright by immunophenotype, I think.
Okay. Anybody wants to say anything, or can we discuss?
So like the only thing I actually like when you trust
All right, I think that's a backup.
size.
Yeah, I just have one thing.
Yeah.
I'm noticing that it's 25 negative. So is that a sign of being a variant?
Right, that's where I was going actually with
Yeah.
this one. So 25 and 123 are negative.
Mhm.
So this is more like a variant phenotype. In variants, you will see 103 is still positive, but 11C is also positive, but 25 and 123 are negative. So this is actually a classic variant. So we'll go more over this. What is a little different from hairy cell leukemia in this one? We'll see what are the similarities and the differences. So in 45 versus side scatter, you see that these cells have a little bit more side scatter than what we traditionally see in lymphocytes. That is because hairy cells usually have higher cytoplasm, and variants also have more cytoplasm, just like hairy cells, and they do have projections also. And monocytes nil, that is something we see with hairy cells, and in variants, monocytopenia is, we always see monocytopenia with hairy cells. And if you do not see monocytopenia, you have to like take a step back and make sure it is hairy cell. And CD20 is positive. Usually it's brighter, much brighter. It's like usual positive here. And 10 negative, 34 negative, that's all fine. And usually surface light chains are also brightly positive in hairy cell. This one is kind of dimmer than usual, what we expect. And 71 negative, 103 is nice, uniform, homogeneously positive, 38 negative, that is all okay. So the and 200 is usually positive, here it is negative. That is a little different from what we are used to seeing in hairy cell. And 103 and 11C again are positive in hairy cell and in variants, but variants are negative for 25 and 123. One other thing you may want to remember is splenic marginal zone lymphoma, which is usually considered as a differential for hairy cell because of its morphology and involving the spleen. But hairy cell leukemia, splenic marginal zone may be positive for 11C, and they are usually positive for 11C, but 103 is not positive in splenic marginal zone. It is kind of specific for hairy cell. So that helps. And they also say that sometimes 27 helps. I have heard that in lectures, but I've never used 27 in B cell tube, so I don't know.
Yeah, we don't use the 27 as well. So.
And 11C in splenic marginal zone won't be that bright, right?
This is not too bright anyway. It's like kind of positive. I mean, if it is bright, I would expect it here.
Okay, so that is not a point. I read it somewhere, so I'm just confirming.
Okay, I haven't. As far as the brightness, I have to go back to the books and check. I don't know.
Okay.
I know that they can be positive. They are usually positive, but I don't know about the brightness.
Okay.
Okay, any questions? Okay, hold on for 1 second. I'll be back.
to look at a peripheral scan to see if there's plasma cells. There do look like there's increase in plasma cells, but there's also some that kind of are, they have like little like eerie like projections. I guess just know if that was like something you can see. He has a history of multiple myeloma. I don't know if that has to be. So this is like an infant. Yeah, yeah. Oh, on wet. Okay. Thank you.
Sorry, I got interrupted. Okay, so can we go to the next case? Hello?
Yeah,
Yeah.
sure. Go ahead.
Okay, today everybody is quiet. Very,
There are less people than yesterday today. It's yesterday there were more people.
okay.
It's
Who's
been a little
gonna
bit busy.
go?
I can go for this case if
Yeah, sure. Thank you.
no problem. But I have to, it's a disclaimer. I'm so sorry. I didn't get the chance to look at this like today's cases, but I looked at 7.1 quickly, and and I saw that it looks. We were just discussing hairy cell leukemia, and to me, the phenotyping looks very similar to hairy cell. So I'm just gonna keeping that in mind. I'm gonna just start saying. CD45 looks, we have cells which are in CD45 positive. The side scatter looks a little bit high. There's monocytopenia. CD20 is positive, but there is this the lymphocytes are showing trail. So there CD34 negative, 10 negative. There is a kappa. They're kappa positive, lambda negative. So there's a kappa a light chain restriction. 103 positive, 38 negative. If we go into the second, so in here we see that the normal population is 5 negative, 23 negative, FMC 7 positive, 200 positive. That's most interesting in this in these plots. And then the last plot, we can see the side scatter increase a little bit more prominent in this 45 versus side scatter. There are 103 positive, 11C positive, 25 positive, and there are dim 123. So that's why I was thinking this was a hairy cell.
Yeah, this is a hairy cell. And you mentioned that there is a trail in CD20. Yeah. I appreciate you recognizing that. If you actually look at the plots carefully, you will see a small lambda positive population, and there is a population here that is in parallel with the lambda. Kind of, there is one bright population here, and there is another second population here, and you will see the lambda here. So there is a background of polyclonal cells, and you can actually see that nicely in the 19 versus 103 plot. The cells that are 19 and 103 positive are a little bit brighter 19 than the background polyclonal B cells. Okay. And even in this plot, you can see kind of two, maybe it's subtly visible, there are two populations. So that's basically why there is a trail. There are background normal polyclonal cells. And you see them here too, like there is a small population, there is a 200 negative, like there is something in the lambda. So same thing. So yeah, this is classic hairy cell that will be positive for 103, 11C, 25, and 123. All four are usually positive.
Great, thank you.
Thank you. Any questions? Okay. Looks like we'll be done in 10 minutes today.
No, we still have the book to read if at all we are done.
Okay, who's gonna go for this one? I'm gonna call on people. Will that be more fun?
I can attempt if nobody's saying anything.
Yeah, okay. Go ahead.
Okay, so I haven't looked at this case, so I'm just gonna guess.
Sure.
On my first.
I mean, take it slowly and go. Whatever your thought process is, just keep sharing, and we'll go.
Okay, so in CD45 versus side scatter, I'm seeing a lymphocyte population, and then I'm seeing granulocyte in yellow, and then there is this debris, which is like a mustard yellow. I don't know what that is, but we'll keep that in mind because I know there are some plasma cells, multiple myeloma can be in that region, but it's a little bit lifted, like it has a little bit higher side scatter. Anyways, let's go the 6 plots at the bottom. Looking at the lymphocyte population, there are CD19 positive. There is a kappa lambda. So there is like a nice, there seems to be polyclonal, that they're like half of them lambda positive, half kappa. In CD5 versus 9 scatter, I can see the orange are, I'm assuming, are T cells. And then we can see the gray, blue are my B cells. Coming to CD38 19 plot, I'm seeing that my T cells are 38 positive. I'm assuming these are T cells. Then coming to 10 and 19, all of a sudden I have a 10 positive, 19 positive population, which is my gray. So that's when I'm thinking that something is abnormal. Then I look at 219, these 10 positive are 200 positive and 19 positive. So that's what I'm now trying to focus. That could be my abnormal population. Going down, I can see my gray population has a lambda restriction. And there are 5 negative, 38 negative, 10 positive, 200 positive. There are 20 positive, so it's definitely a B lymphoma. And then if I keep going, their lambda restriction is as we established before. And coming down, I can see that they are all of a sudden 103 and 25 positive.
So this is a different tube.
This is yeah, completely different. Like this is a hairy cell tube, and right, because it has 25 and 103, and so that prompts me that I'm dealing with, and they're 11C positive, right? Then my 19 is 11C positive as well. So that prompts, that kind of makes me think, am I dealing with hairy cell leukemia? And then if I go down, so I have now 2 populations, one that is 103 pos, and there is 10 pos, but 103 neg.
Okay, so now that you have seen the whole thing, take a look at it again.
Okay.
May I add? I think there are 2 abnormal, gray and the aqua. There are 2 abnormal, and then look at them separate, like, because there is one plot in which this plot, they segregate like 19 and 10. Like one of them is 19 positive, 10 negative, and another one it is 10 positive and 19 positive. So there are 2 things going on in this one, I think.
Okay, so let me go to one of these. Okay, this one, we'll go back again to the top, but let's look at this one first. So here the kappa population is red and the lambda population is the dark green. Actually, the dark green, you can actually see it all over. It's just that this gray and aqua population are on top of it, that it's kind of hiding it. So the normal background polyclonal B cells are the red and the green population. And what we see here in aqua and gray are the abnormal population, and those are a little bit brighter 19 and a little bit brighter 20 as well. So we'll trace them from here. They have a little higher side squarer, both of them, and they're brighter 19. They are both lambda restricted. They are both negative for 5. They are both negative for 38. And there is one population, which is the gray, that is positive for 10, and the other population is negative for 10. And they are both positive for 200. And then in this one, this is just much cleaner. We have removed everything else except the B cells in this one. So I just wanted to give you a cleaner one. And this is also cleaner. So both populations are 20 positive, and they have a little bit brighter 20, and this is kappa, so they are lambda restricted. They're negative for kappa. And then again in 10, you can see that there is a gray population that is positive for 10, and there is another population negative for 10. They're both negative for 5. They're both lambda restricted. You can see the background lambda positive cells. So this one has a little bit brighter surface light chain expression than the background polyclonal cells. And this is pretty much the same. Both populations are restricted for lambda. You can see that nicely here. So when you come to your hairy cell tube again, they backgated this. This is the B cells, 19 positive. And in that, there are two populations, both are 20 positive. So again, they are both B cells, but one population is positive for 25. The other one is negative for 25. And the population that is positive for 25 is also positive for 103. And so again, 11C, there is one population that is positive, and the other, and that population also has a brighter 20 compared to the other ones. And again, 10 kind of nails it, 10 versus 103 nails it, that the population that is 103 positive is negative for 10. And this is a separate clone, and you have the normal background polyclonal B cells here. So we have a clone of hairy cells along with a separate population of 10 positive monoclonal B cells. That's what this is about. And hairy cells actually can express CD10. I think around, I don't know the percentage, correct me if I'm wrong, I think 10 to 15% of cases can express CD10. Very, very, very rarely they can express CD5, but for all practical purposes, we don't consider that. For hairy cell, 103 is the, both hairy cell and variant 103 is the most specific marker, which is why most labs just add 103 in their regular panels, even if they don't include the other 25 or 123 in their panels. So any questions or comments?
Oh, sorry. You can go ahead.
No, I'm so sorry. Like, go ahead, please.
So this is my first time to study so deeply the flow cytometer. So here, like here, we can see there are multiple, in the first plot, we can see multiple types of cells. So how can we focus in particular so that can we reach to a final diagnosis? Like here we can see yellow and some gray. So how can we first focus first thing, which we have to first thing first in this type of complicated type of plots?
So you will see, so first of all, when they gate these things, they will, the gray population and the blue population are actually backgated. You cannot get them from side scatter versus 45 plot, you cannot. So what we do is, like, first they will, this is a B cell tube. So the B cell tube, when they subgated, they usually have one plot, side scatter versus 19. So they will select all the B cells. Then they will have a kappa lambda to see the separation. So in kappa lambda, sometimes you will see two populations, one with a different intensity than the other. So then they try to kind of identify which one of the two is abnormal, and they can backgate it. But here in this one, they would have clearly gated this 10 positive cells first, and they would have seen where it is sitting in all the other plots, and they would have identified, okay, that is 19 positive and 20 positive, so it is in the B cell, and it's lambda restricted. And they would have seen that there is a brighter population for CD200, and they would have gated that together also. And then maybe the 10 gate was after that. Basically, in this one, the 200 positive, really bright 200 positive population gives it away. We don't expect that in a normal lymph node. There will be a spray of 200 positivity. They will have dimmer 200 positivity, but this one stands out with really bright 200 positivity. So they must have first, they probably took this one first, and then they backgated it, and then they saw where it is sitting in all the other plots. Yeah, because you cannot really separate it from the other plots. 200 is the one. 200 and CD10 is how they separated it. And then when we go to hairy cell tube, it becomes much easier because there is one population that is really bright for 25, and 103 is like kind of distinctly positive. 11C is also distinctly positive. So that's how we nail it down.
Okay, thank you.
You understood what I'm saying?
Yes, yeah, thank you so much.
How would you line it up in the final diagnosis? Like, what would be your line diagnosis?
So we would say one population, CD 103 positive, kappa restricted monoclonal B cell population consistent with hairy cell leukemia, and then the second line, a separate monoclonal CD10 positive a lambda restricted population is identified. We would write it like that. Anytime we see two clones, we write that a separate whatever restricted this much percent B cell population is identified. We do that.
And when you do the percentage, is there any particular plot that you choose where you like circle and like draw the percentage, or where you see it as a discrete population? I mean, where?
So when you use quadrants, the quadrants will display the percentage of cells in that quadrants. In cases like this, when actually there is a front page that has a lot of patient info. I'm not displaying them here. So in the front page, you will see the percentage of these cells as a subpopulation. So they will say all CD19 positive cells, this much. And then under the CD19 positive cells, they will give 10 positive, this much, like that. So you will see the color in that color coding will be there. This color is this much, this color is this much. It's like that.
I just had a question regarding page 3, the one that has 103, this one, 103 and 25. This, for me, I'm seeing 3 plots, 3 population. There is one blob, which is red. Then there is one that is 103 negative and looks like 25 positive, because it kind of sits in the same at the same plane as the 103 positive, 25 positive, and then there's one below. So I'm seeing 3.
Yeah, you are right. You are seeing 3, and I don't have an explanation for that. I do see that in here too. We see that here also. Yeah. This population, we see both the blue and the red population here. We know that this particular population are not hairy cells. I don't know if the 10 positive cells are co-expressing that, because we didn't have, the 10 was a separate tube. It just had 10, 20, and 103. This was like the 4th tube to solve the clones, if they are same or different. And this, in the regular hairy cell tube, there was no 10. So I don't know if this is the 10 positive population. It does not, because this is what we think is the polyclonal B cells. So this could be that, but I have no way of saying it for sure. Okay. But that is abnormal. That is unusual.
That is, that's true. Okay, thank you.
Any other questions? Okay.
Nice cases, Ravi.
Okay.
Very nice cases.
Thank you. All right, so let's go to this one. This should be easy. Whoever wants to do this. Okay, I think Shweta or Halima, you are the only people who are talking today.
I can do it. It's fine. It's like my numbering on my page and my, like, your grass is changed. And that's why, like, my hairy cell, on my number, it was hairy cell and the next one was variant. And it's
oh, okay. Yeah. I skipped that one because I wanted to first show you variant.
Now because my paper, I'm not like following the same. But okay, I'll look at the graphs and I'll do it then.
Yeah.
I'll not look at better. My paper now.
Okay. But this is number 9, case number 9 in case.
Okay. One, it's like, I think it's a blood or a bone marrow specimen. There's a lot of Grant's monos in the background. That's what I saw here.
Very good, yes.
Yeah.
Perfect, yeah.
And this one, I do not know the reason for this, but that blue population has a tail kind of going up. Is it like kind of trying to, the cell size is bigger and they are going into monocyte? I'm not sure on what exactly that means.
I have a feeling it's it's the washing problem. Like the tube needs to be washed, or oh no, I've seen that when there wasn't enough, like there wasn't enough volume, and then the instrument kind of sucked the tube dry.
It is an artifact. I know that it is an artifact. I don't know the reason for that artifact, but maybe Halima knows what it is. But it is an artifact. So you have to ignore that.
Okay. Okay. Then this population is 20 bright, 10 negative, 34 negative, and kappa positive, lambda negative. So it is kappa restricted. Then there is it is 103 negative, 38 negative. So so far we know it is a kappa restricted CD29 20 bright population.
So do you know what this population is? Just sorry to interrupt. This thing that is negative for 19, it is blue in color, so it was here.
Yeah.
Or the artifact, it is here.
And it's showing in 38, right?
Yeah.
Is it plasma cells going somewhere?
So would plasma cells, I mean, plasma cells
Should have
number
some
one.
19 too, right?
It could be dendritic cells.
Dendritic cells. Okay, I'll answer that.
Are T cells negative for 38?
Yes.
Okay. Right.
So the T cells are here.
Hmm.
So these are your NK cells.
Okay.
So NK cells are 38 positive, and the plasma cell 38 is brighter than the NK cell 38. So that would be somewhere here, like plasma cell 38 would be. So it's nice to remember, because when you see a population of plasma cells, I mean 38 bright cells, you want to compare it with something. NK cells are the ones to compare, because plasma cell 38 is brighter than the NK cell 38. So it's good to remember, and they are here along with your T cells, and which is why they are negative for 19, and you get them here along with them. And dendritic cells do not have this much bright 45. They are more in the near the blast gate. They will have a little dimmer 45 than NK cells. To be honest, I don't know if dendritic cells express 38. I know basophils do. I have to check on 38 for dendritic cells. Sorry about that. Okay, let's go back to our second plot.
Okay, so now again, this population is 19 moderate. There is some expression of 23 partial, I would say, and then FMC7 positive, 200 negative, 23. Again, like partial positivity is there, and then it's kappa restricted. There is no population of 19.5 positive cell in the last plot. Where are we? Okay, and then again 20. Oh, we did that.
That's all. We're done.
Okay, so this is I think it is. We will just call it like kappa restricted mature B cell neoplasm. That's where I am. I won't go after this partial 23 positivity with anything. It's 5 negative, 10 negative. So
yeah, okay. So it is 5
subtract
negative and 10 negative. When it is 5 negative, the partial 23 positivity is not abnormal. I mean, even in normal lymph node or lymphocytes, you will have partial 23 and partial 200 positivity. That's okay. If it becomes relevant only if it is 5 positive.
I have always seen this 23 is always kind of, kind of a smearing type
Exactly,
kind of population.
Yes. Yeah, you
So,
do see a
alone
small
with this,
smearing.
yeah.
That alone has no significance.
Yeah.
Especially you have to see if it is expressing 5 and if it is monoclonal. Only then it is significant. In this case, what you said is right. The only thing we can commit at this point is 5 negative, 10 negative, kappa restricted monoclonal B cell population. That's all. That's how we will sign this flow out. And this one actually turned out to be marginal zone lymphoma, and marginal zone lymphoma has a little bit of 23 sometimes. Have that. Any questions? Okay. Okay, this one.
I can do that too.
Okay.
It's okay. So this, the first plot is interesting. It's this 45, the blue population is going up. I would like to see a forward scatter on this case, because I think I'm supposing these cells would be bigger cells in size. And if we go to the next plot, they are 20 positive, 34 negative. Then kappa positive, lambda negative. They are 71 positive. Yesterday, we were talking about 71 positivity is seen in DLBCL and Burkitt, and that's why I was saying I want to see the size of the cells too.
Okay.
Because of that reason. They are 34 negative. where are we? Okay, they are 19 positive, moderate, and they are FMC7 negative, 200 positive, 23 negative, kappa restricted, and then 103 negative, 38 negative. So I mean, I won't commit calling it as I was thinking on DLBCL, but I won't call it on this, like just based on the flow. I would call it again a mature B cell neoplasm 510 negative, but I would like to see a cytospin on this one to see the cell size and all. And I mean, just like looking at it, I'm suspicious for like some high grade lymphoma with bigger cells.
Okay, that's a very good pickup because that's basically what I was trying to show. You described it correctly, and 71 positivity can be seen in DLBCL and Burkitt. That is correct. And also 71 is positive in the germinal center B cells. So you can see that even in reactive germinal centers and in follicular lymphoma. But it won't be like a homogeneous bright positivity. It is always like this partial positivity. And this one was a marginal zone with transformation with a lot of large cells. It's a lymph node. And the large cells were having the highest site scatter, like what we see here. So this was a transformation, marginal zone. It had like around 30% large cells in this case. Okay, so any questions? I don't think. Okay, you're done.
Beautiful
I think we can
cases,
finish
Ravi.
reading also today. Hello, sorry.
Yeah, beautiful cases. I love those cases.
Thank you.
And when you start talking, I just stop thinking anything and just start listening to you.
Nobody has given me such compliments, Akasha, so thank you.
No, really, that's the truth. See, everyone says I learned a lot. See, okay, I haven't read the book as yet, but we can read together. Today was really busy for me, so let's see. Do I have the book here? I thought in the morning I took the book out somewhere, but I think I might have closed it. Okay, let's see. So I'm now doing from the CAP website itself, because I think it's clearer in the CAP website. Okay. All right, so I think we did up till here. We really have to read about hairy cell in this one, and then the other one that we can read is the B cell unclassifiable. Actually, we didn't do really. I think the only one that we have to read is the hairy cell. Yeah. Yeah. Okay.
Yeah, I think so.
Yeah. So let me quickly read all of this. So, previously healthy 43-year-old man presents to primary care physician complaining of lump in the upper outer abdomen, several months, feeling of fullness. He's noted on exam to have significant splenomegaly, lymphadenopathy. Those are important things. CBC shows leukocytosis with normocytic anemia and thrombocytopenia. The white cell count predominantly atypical lymphoid cells, intermediate size with moderate to abundant cytoplasm, cytoplasmic projections. Okay. Then they have this plot. So over here, they are showing this red population, which is 19 bright, 103 bright, 11C is there, 25 is there. And this looks like it is more of lambda over restricted. And then 20 is kind of bright, 5 and 10 negative. So this is a typical hairy cell, and you showed it very nicely. So let's read. Flow cytometry of the peripheral blood shows population of B cells with increased site scatter that is present in the position usually occupied by monocytes. Okay. So, and then on CD45 versus site scatter. So this is really a monocyte gate. And then true monocytes are scarce. And then the abnormal cells express bright 1920 show lambda right chain restriction. The population is negative for 5 and 10, but expresses 11C, 25, and 103. Combined morphologic and immunophenotypic features are hairy cell. The hairy cell leukemia, 2% of the lymphoid leukemias. median age 50 to 55, often splenomegaly and profound monocytopenia. Because the infiltrate in the marrow is associated with fibrosis, patients with hairy cell leukemia have a dry tap. Thus, flow cytometry of the peripheral blood or a disaggregated bone marrow core biopsy will be useful. Hairy cell leukemia consists of proliferation of clonal mature B cells expressing high density of 1920 with co-expression of 11C, 25, 103, and 123. Because of the abundant cytoplasm present in the neoplastic cells, cells of hairy cell typically have mildly increased forward scatter and side scatter as compared to the resting lymphocytes. In most cases, hairy cell is negative for 5 and 10. However, 10 expression is seen in subset of the cases, and as 11C, 25, 103, and 123 are not included in the initial B-cell lymphoma panel in many laboratories, recognition of this common immunophenotypic variant prevents misclassification of follicular lymphoma. An additional feature characteristic of HCL is relative absence of the monocytes. In cases in which monocytopenia is not present, care should be taken to exclude potential alternative diagnostic considerations. So now they are showing a CD10 positive hairy cell leukemia. That's very interesting. So again, it can be seen in like 10 to 26% of the population. So here we see the bright 19, 10 positive population, that is 103, 25 positive, 11C positive, bright 19. Again in the monocyte gate. So that's a 10 positive hairy cell. Hairy cell leukemia is typically negative for 5 and 10. However, 10 are positive cases are occasionally seen and should not be confused for follicular lymphoma. In this peripheral blood example, an abnormal population is noted initially on CD45 versus side scatter, with increased side scatter as compared to the normal background lymphoid cells. T cells are highlighted in green. The abnormal cells express kappa light chain restriction, that is not shown, and kappa expressing B cells shown in blue. The lambda expressing B cells are shown in red. With bright 19 and 10. And of note, true monocytes are scarce. A tandem peripheral blood shows that abnormal cells have abundant cytoplasm, circumferential cytoplasmic projection characteristic of hairy cell. Additional markers are performed and demonstrate that abnormal cells express strong 11C, 25, 103, conforming hairy cell. Abnormal cells shown in blue and normal cells shown in magenta. Distinguishing hairy cell from other low-grade B-cell lymphomas is critical because hairy cell in particular is sensitive to purine nucleoside analogs and has a good prognosis with appropriate therapy. Marginal zone lymphoma, specifically splenic marginal zone lymphoma with villous lymphocytes and hairy cell leukemia variant, are often in the differential diagnosis of hairy cell leukemia. Similar to hairy cell leukemia, splenic marginal zone lymphoma often involves spleen, marrow, blood, and is characterized by atypical lymphocytes with abundant cytoplasm. In contrast to hairy cell, the lymphocytes in splenic marginal zone are polar rather than circumferential cytoplasmic projections. In addition, although expression of 11C is common in splenic marginal zone, the cells are typically negative for 103 and 123. So 11C is present, 103, 123 will be negative in splenic marginal zone. In addition, the splenic marginal zone is typically positive for 27, whereas hairy cell is not. Oh, that's important. So splenic marginal zone is 27 positive. I didn't know that. Hairy cell variant is not typically associated with monocytopenia. Yeah, that's what I was thinking. So variant is usually not associated with monocytopenia as seen in classical HCL. The neoplastic cells in HCL variant do have cytoplasmic projections, but in contrast to hairy cell leukemia, often have prominent centrally located nucleoli. With respect to immunophenotype, variant will express both 11C and 103, negative for 25 and 123, allowing distinction of this entity from classic hairy cell in most cases. Take-home points composed of mature B cells, bright 19, 20, co-expression of all these. Distinction is critical. Okay, I don't think we read a whole lot in this, like anything addition. Maybe what we learned was a CD10 positive hairy cell can be present in many cases. And we used to have in our book, let me open our book only. In our book, we used to have a nice differentiation chart between variant and splenic marginal zone. I think Kshitija made that chart. Let me see. So book 11. Okay. Actually, I should go here. Let's see if we can quickly go over that, because that will be relevant in this particular scenario. Large B cell, follicular, hairy cell. Okay, 40. So they have this classical hairy cell and variant hairy cell. And I thought Kshitija also made, I think it would be in splenic marginal zone maybe. No. It was a big chart. Let's read about the variant and the classic first. So bone marrow dry tap, let me enlarge it, it's very small. So this is actually from Anju. Bone marrow dry tap will be seen in classical hairy cell, aspirable in variant hairy cell, lymphocytosis in variant, monocytopenia in classic, prominent nucleoli as we read in variant, cytoplasmic projections in both, and both are hairy. 25 positive is classic, as well as annexin positive is classic, 25 negative is variant, and then 103, 123 can be variable in case of variant. Annexin is negative, and then these B cell markers and 11C is kind of non-specific, so it will be there. BRAF will be there in classical, will not be there in the variant. And again, the prognosis for this one is good because of the response to purine analogs, and this one is poor. And let me see if I can find that one. Looks like it might be nodal marginal zone. I don't know. I thought there was a Kshitija table somewhere. I like Kshitija's table, nodal marginal zone. No. Yeah, maybe I can't find it. But there was a nice table that maybe if you guys go back and look into the book, if you have it, you might find it. Okay. Let's quickly read the hairy cell from here as well. I mean, since we have a few minutes and that are remaining. So, hairy cell leukemia. Indolent neoplasm of small mature lymphoid cells with ovoid nuclei, abundant cytoplasm, hairy projections involving peripheral blood, bone marrow, and splenic red pulp. Rare, middle-aged to elderly, male predominance. BRAF in all cases, BRAF mutation, leads to constitutive activation of MAP kinase. Commonly, bone marrow and spleen, peripheral blood circulating cells seen, liver, lymph node, and skin may be involved. Clinical presentation, weakness, fatigue, upper left quadrant pain, fever and bleeding, splenomegaly, pancytopenia, monocytopenia, hepatomegaly, recurrent infections, immune dysfunction. Splenomegaly, there will be this in particular red pulp with blood lakes, which is kind of a buzzword that they use. Peripheral blood, hairy cells, so small to medium sized, with kidney-shaped nucleus. So this one may be kidney-shaped. Inconspicuous nucleoli, spongy ground glass chromatin, less clumped than normal lymphocyte. Cytoplasm is pale blue, abundant with hairy projections on the edges and may contain vacuoles or rod-like inclusions. Bone marrow diagnosis best made on the bone marrow biopsy. Increase in reticulin fibers lead to dry tap. On aspiration, interstitial or patchy involvement with some preservation of fat or other hematopoietic elements. Infiltrate consists of so in the bone marrow, there will be widely spaced lymphoid cells, closely packed nuclei in other indolent lymphomas. So this one is more widely spaced. Usually they are closely packed in the other lymphomas. And then that gives it like abundant cytoplasm, prominent borders, gives it a fried egg appearance. So that's the fried egg appearance in the bone marrow. In cases with hypocellular marrow, performing the immunostaining for B cell antigens 20 to avoid misdiagnosing and aplastic anemia. So then spleen, again, the infiltrates will be in the red pulp. The white pulp will be typically atrophic. Blood lakes, red blood cells surrounded by hairy cells due to disruption of the normal blood flow in the red pulp. And other organs, liver, spleen, lymph nodes, or other extramedullary involvement can be there. So again, this one is a nice fried egg appearance that is seen. And then you see the 11C, 103, and XNA1 and PAX5, so B cell population that is expressing all of these. Cytochemistry, the trap positivity, they used to give it a lot of emphasis previously. I think that now the annexin and BRAF are more important. Immunophenotype, positive for bright co-expression of 20, 22, 11C, expression of 103, 25, 123, TBET, and annexin A1 is most specific. FMC 7, 200 will also be there, and cyclin D1 is also positive in hairy cell lymphoma. And then negative for 5 and 10, rare cases can be 10 positive, as we saw. And then minimal residual disease, best assessed by multicolor flow cytometry targeting hairy cell profile or immunostaining for TBET. And BRAF protein is also present. So annexin A1 and BRAF is shown here. And so then prognosis and treatment. Okay, so most cases over here, genetics BRAF V100, V600E, and then IGHV genes with somatic hypermutation seen in most cases. All right, prognosis and treatment. Most cases respond to interferon alpha or nucleosides. Relapse is treated with rituximab, anti-CD22, and BRAF inhibitors. Now, coming to the splenic marginal zone and classic hairy cell. So coffee bean nuclei, oval nuclei is seen in hairy cell. I mean, it's hard, but it will be round nuclei in the splenic marginal zone. This is important. The polar projection, non-circumferential projection in the splenic marginal zone. This one is more circumferential. And then bone marrow infiltration pattern is diffuse or interstitial with the fried egg typical. In case of hairy cell, this one is more nodular or intrasinusoidal. Splenic infiltration pattern, this is more of red pulp, this is more of white pulp. In this, the white pulp is atrophic. And then CD123, BRAF, V600E, and annexin A1 are positive here, they will be negative here. And then the variant, quickly let's read that, we have 3 more minutes. So the B cell lymphoma leukemia unclassifiable have 2 categories. First is splenic diffuse red pulp small B cell lymphoma, SDRPL, which is hard, I mean, I personally haven't seen a case of splenic diffuse red pulp small B cell lymphoma. It's kind of, I think, diagnosis of exclusion or something. And then there is a hairy cell leukemia variant. So this red pulp, as the name suggests, it is the red pulp involvement. Intrasinusoidal B lymphocytes. So intrasinusoidal B lymphocytes, diffuse red pulp involvement with massive splenomegaly. Again, villous lymphocytes will be seen in this one as well. Diffuse involvement, blood lakes, small to medium sized, pale plasmacytoid cytoplasm. So this one is CD20. DBA44 is another one that they have mentioned on this one. And IgG. They can also be 103 and 11C positive. And these, however, the more important or specific markers like annexin A1, 103, 123, 11C can be negative as well. And the others will be negative. And then this is let's skip all of that. The treatment is splenectomy. Hairy cell leukemia variant, that's important. So now marked leukocytosis, that's one of the things. So 30 into 10 power 9. Monocytes, normal absolute count. So monocytopenia is usually a feature of classic hairy cell leukemia rather than variant. Leukemic cells have prominent nucleoli, absent circumferential shaggy contours. So the shaggy contours are absent. BRAF, wild type BRAF, it will not be mutant. And then absence of CD25, 123, annexin A1 and TRAP. No response to cladribine. So again, there is splenomegaly, leukocytosis, thrombocytopenia, anemia, middle-aged again. Males are again more common. Peripheral blood, circulating leukemic cells. And then they also have hairy projections. That's why they are like hairy cell leukemia variants. And then nucleus, variable features, condensed chromatin, central nuclei, dispersed chromatin, irregular nuclear contours. Convoluted hairy cell leukemia is transformation of hairy cell leukemia to large cells with convoluted nuclei. And then there is no dry tap on this one. It is aspirable and infiltration will be more subtle on this one. This is more of distinct predilection to sinusoidal infiltration, and ISC will be needed. Okay. And then red pulp is expanded blood lake sinusoid. So all of these are the similar as the hairy cell, as was mentioned. And again, the positivity. So the negatives will be 123 again, annexin A1 again, CD25. So those are more specific to hairy cell, TRAP, and CD200. And then positives are more the other ones. So 11C is positive, 103 is positive, DBA44 is positive, bright monotypic IgG. And then no BRAF mutations, and few cases can have P53, recurrent MAP kinase, treatment against splenectomy, and cladribine not effective. Cladribine and rituximab together can have long-lasting response, and we read that already. Yeah, so now it's LPL here. Okay, I think perfect timing, 5 o'clock. So anything to add, anyone? Anything that you would like to tell, chat?
Somebody said great.
Okay, cool. All right. So, all right then. Thank you very much for joining. Thanks for teaching me, Raji.
Oh,
And
you're very welcome. I think we discussed more in the initial stages. I think when we go more and more, discussions are going to get a lesser and lesser, I think.
the first one was more of what everyone knows, like the B cell, small B cell lymphomas. So those, like everyone sees that it is so common, everyone knows, and everyone is excited to look at that. Eventually, when we have T cell, when we have the more unusual stuff, then it will start getting less and less.
Yeah, I think myeloid will have a lot of discussion. Probably.
Myeloid might have a lot of discussion, yeah, because all of those monocytic variants and the others, they will NPM1 and the others, A21, everyone gets excited with all of that.
Yeah, I actually have one case today, but anyway, I'll show you later.
Save it, save it.
Yeah. Okay.
All right then, guys.
That's
See you
good.
Ready to go? Halima, you saying something?
No, I just said thank you so much. I'm learning so much from this. I'm so glad that you guys did this. I usually I'm kind of a running from work. Like probably I'm the fastest. I hope the police doesn't stop me because I'm trying to like rush to go home, like to go home to open the computer to join you guys. So thank you.
Actually, you should, originally thank Shweta for that, because Shweta was the one who came and she was like, I want to learn flow cytometry and I want to just brush all my knowledge, and she's actually so good.
Really? Oh my God. Awesome. Thank you, Shweta.
No, you guys are inspiration, man. I mean, I'm learning so much from you. I can't explain in words like how thankful I am.
Oh my God.
Me too. And actually, that's why I original plan was that Raji is going to teach Shweta, and maybe Dr. Mirza might take a couple of sessions. But then I was like, I want to learn too. Why would I be excluded? And then I started thinking maybe other people also want to learn. So I was like, okay, let's take this to the larger level, and let's do this what we did with the WHO book club.
That's been the thought process with, I think, underlying every book. Like, not only do I want to learn, maybe there are other people like me.
Yeah, exactly. Yeah. All right, guys.
Thank you very much.
Yes. Thank you.
Tomorrow.
Thank you.
Bye.
Thank you.
Thank you.